The main one that we see the most is paracetamol, which is your main sort of first line sort of analgesic or painkiller, primarily because it's in normal dosage it's the safest, so you don't have the side effects of stomach irritation or exacerbating asthma, etc. That you can do with what would be the second class, which is your NSAIDs or non-steroidal anti-inflammatory drugs. Most common of those would be ibuprofen. But again, with those you've got the issue where it can irritate asthma. It's not suitable for people with pregnancy, and also people with heart conditions or problems with the kidneys, etc. They can't use those drugs, or if they are, they'd have to be under supervision by the GP. And third sort of class, we tend to see some people who are on the opioid analgesics. So the most common one being sort of cocodamol, which is sort of codeine being the weakest of the opioids. But again, you've got certain issues with side effects, most commonly constipation, can cause some drowsiness, etc. I think it's important to have an open mind with it. Obviously, there's an element of osteopathy being a holistic healthcare system, but my personal belief is that osteopathy works sort of well with the sort of more pharmaceutical-based approaches as well. Obviously, a lot of patients will come to us already taking some form of painkiller, like the paracetamol, ibuprofen. And it's important, if that's being prescribed by the GP, that they continue doing so. Certain conditions that cause back pain can be inflammatory conditions, diseases like ankylosing spondylitis, etc., where taking anti-inflammatory drugs is really vital to the treatment of those conditions. And so that osteopathy helps manage the condition in conjunction with using the ibuprofen. Say with mechanical back pain, obviously can be treated on its own with osteopathy, but providing the painkillers are safe for the patient to use and they've been sort of say recommended by the pharmacist or GP, they're a good addition to treatment. So when patients are coming to us, they're worried that the painkillers are on masking the symptoms as such, and they were worried that they should come off the painkillers before treatment. My main thing is, especially if the painkillers are being prescribed by the GP or pharmacist, that they keep taking the painkillers. The painkillers, they take the edge off the pain, they don't kill the pain completely. So for like chronic back pain, chronic pain conditions, it sort of will take the edge off their pain, but it won't sort of stop the pain, sudden pain signal that they get. Say if they suddenly tweak their back, lifting something too heavy, they'll still get those warning signs from their body that they're doing too much. So in that sense, taking the painkillers isn't a concern from my perspective, that it will mask that sort of protective reflex in the patient. If a patient's taking regular painkillers, I wouldn't get them to change their sort of dosing regimen of the painkillers, because obviously one of the main things is that people use the correct dosage of their painkillers that are being prescribed by the GP or pharmacist. So say like your paracetamol typically is 2-4 times a day, or ibuprofen tends to be 1 or 2, 3 times a day. If you start changing the dosing schedule and missing doses and say taking a suboptimal dose, then it gets to the point of, well, if you're not taking an effective dose, then you might not be as well be taking them at all. So I would suggest that they keep to their recommended dosage regimen that they're on and not to change it.